AM-TRAN transports medical specimens between different types of medical facilities, including doctors' offices, laboratories, and hospitals. Specimens are transported in coolers dedicated to each of the three types of specimen: ambient room temperature, refrigerated, and frozen. All containers are appropriately marked with biohazard labels. Drivers are trained in the proper transport of such materials and must pass a competency exam prior to handling. This training provides the details of the lab courier procedure. Prior to driving, locate the route sheet and timestamp the first page. Contact the dispatcher to let them know you have signed in. Walk around the vehicle and make note of any abnormalities, which, if found, need to be reported to dispatch. Identify if there are any supplies that are to be delivered along the route. Prepare the transport containers. Verify that the vehicle has gloves, disinfectant, a spill kit, and notification tags in an area separate from the specimen cargo area. If your vehicle is determined fit for use, you may depart on your route. If your vehicle is determined to be unfit, you must report to dispatch, who will assign another vehicle, and these procedures will be repeated. Drivers are responsible to fuel the vehicle as necessary. Each vehicle is equipped with 4 specimen transport coolers, which are to be cleaned before every shift. All transport containers are clearly marked, defining its utility purpose. To clean the container, put on gloves and spray with a disinfectant bleach solution. Wipe down using a paper towel. Be sure to clean the interior and exterior of the container. Dispose of gloves and paper towel in the trash can. Preparing the ambient room temperature specimen container is easy. Once the container is clean, it is ready for use. To prepare the refrigerated specimen container, start with a clean container. With bare hands, open the container. Using gloves, place 4 to 6 ice packs inside the cooler. Do not close the container yet. Remove and dispose of gloves in the trash can. Close the container. Remember to open and close the container using clean, bare hands. To prepare the frozen specimen transport container, start with a clean container. Locate the heavy-duty gloves and dry ice scoop near the dry ice bin. While wearing heavy-duty gloves, use the dry ice scoop to collect dry ice and place inside the cooler to approximately half full. Do not cover any temperature sensors with the ice. Be careful not to come in contact with dry ice. Close the container and place the dry ice scoop and gloves back where they belong. Please note, dry ice is solid CO2 and can be fatal if vapor is inhaled in large quantities. If dizziness or headache occurs, get to an open-air environment quickly. Dry ice is extremely cold and can cause frostbite in seconds. Dry ice is only to be handled using heavy-duty gloves. All containers must be labeled as biohazard. You must notify dispatch if the biohazard label is missing and either affix a new label or obtain another container that is properly labeled. Couriers will only use biohazard containers for infectious substance and specimen transport. You must never place consumable items such as beverages, food items, or pharmaceuticals in a specimen transport container. Each vehicle is equipped with a phone for direct contact to the dispatch office. Drivers are to use Google Hangout Instant Message in addition to voice calls throughout the day. In addition, each courier has a personal cell phone if necessary. Couriers are not to give personal cell phone numbers to customers. All customers are to be referred to the dispatch number, 877-243-8733. Each vehicle is also equipped with a company-issued fuel card. After fueling, you are to obtain a receipt and attach it to the route sheet. If for any reason the fuel card will not work, you may refuel using personal funds, which will be reimbursed promptly. Note on the receipt that personal funds were used and notify the supervisor of the incident. At the start of each shift, there may be reports and/or supplies to be delivered to customers along the route. Reports and supplies are filed near the back door at 3375 Hillview Avenue by 7 a.m. You are to check the file area and the office area prior to departure, identify reports and/or supplies along your route, and take them for delivery during your shift. All report and/or supply deliveries are to be noted on your route sheet. Sometimes there will be reports and/or supplies to be delivered that are not on your scheduled route. It is your responsibility to notify dispatch as soon as possible for scheduling during the day. These deliveries will be tracked electronically. When picking up specimen, it is important to check for samples in appropriate areas. Be sure to check for refrigerated, frozen, and ambient room temperature specimen. In addition, you may not know exactly what you are transporting. It is imperative to treat all specimen as potentially infectious and handle accordingly. Similarly, it is your responsibility to preserve the integrity of all samples by maintaining proper temperature at all times. After locating specimens, open specimen transport container or cooler with bare hands. Put on gloves. Pick up the specimen and place inside the proper transport container, being sure to count each requisition. Avoid cross-contamination by never touching door handles, countertops, pens, or other clean items while wearing gloves. Take your gloves off. Place worn gloves inside the specimen transport container for disposal off-site. Never wear gloves if not immediately handling infectious material. If you walk around with gloves on, patients and staff will assume the gloves are contaminated with infectious material. This will cause concern about skin contact with door handles and other items you may have touched. Once your gloves are off, you can close the transport container and document your pickup. Fill out any documentation that the stop requires. For stops that require many samples to document, wear one glove on one hand and do not wear a glove on your writing hand. Use your gloved hand to place specimen in the transport container and use your bare writing hand to document with a pen. This will avoid cross-contamination of the pen and the log sheet. Daily stops must be serviced at the assigned scheduled time every day, Monday through Friday, unless otherwise noted on the route log. You may not service a scheduled stop before or after scheduled time unless you get approval from your supervisor and the dispatcher is notified. If you can't meet time obligations, you must notify the dispatcher. On-call stops are unscheduled stops that place a request with the dispatcher when courier service is needed. The dispatcher will notify the courier electronically when an on-call customer has requested courier service. Pickup and delivery of on-call requests are tracked electronically as well as on the route log sheet. You may receive samples from on-call clients when you make a delivery to that client. If you receive such a sample, contact dispatch who will enter the order into the system. It is possible that you will not have time to accept this delivery in order to remain on your schedule. In this case, dispatch will assign a different driver to make the on-call delivery and you will continue on your route. Couriers must be cautious when picking up after hours. Oftentimes, an office will be closed but staff will still be working inside. Some offices do not put specimens in the lockbox until after they leave the building. It is during this time that the specimens are at a higher risk of not being picked up. Do not assume that because there is no lockbox there is no pickup. A lockbox is a foam-insulated steel box used for courier service after business hours. The insulation is important in preserving the integrity of the samples. Lockboxes should preferably be placed in areas that are not in direct sunlight. When looking for a lockbox after hours, check all doors, walls, hallways, stairwells, and bushes. Every office has a personal preference for using a lockbox. If no specimens are found in the lockbox, attempt to check inside the office. If the door is locked, knock on the door. If there is no answer, look for signs that someone might still be inside, such as office lights are on or vehicles parked in the parking lot. If the stop is a scheduled daily stop or an on-call that has requested service, contact the dispatcher and they will attempt to call the office. If no one can be reached to verify that there is nothing to pick up, leave a "Sorry we missed you" form on the door or in the lockbox. This will alert staff to contact courier services to request courier pickup. If a lockbox containing specimens is found unlocked or if a sample is left out without a lockbox, the courier must complete the Unlocked Specimen Box Notice form. This form is a full-page form unrelated to the courier notification form. The white copy will be left at the office. The pink and green copies must be turned in to the courier dispatcher for reference and notification for Department of Consumer Affairs. When servicing a patient service center, or PSC, it is imperative to check for refrigerated, frozen, and ambient room temperature samples. Be sure to inspect the refrigerator thoroughly. Look in door shelves, drawers, and freezers. Some PSCs have more than one refrigerator. Be sure to always check for additional refrigerators and freezers. Some PSCs fasten their room temperature samples to outside the refrigerator door. This is commonly overlooked by couriers because they do not expect it. Always check the front of the refrigerator for any notes or specimens before opening the refrigerator. The preservation of the correct temperature of samples during transport is crucial to the proper resulting of a test, and could be as serious as life or death for a patient. Couriers must be careful to keep samples separated into proper temperature categories at all times. Couriers must not place specimens into incorrect transport containers even for a short period of time. All specimens must be transported in closed-top containers from the pickup area to the destination. Samples found at room temperature in an office or a lockbox should be kept at ambient room temperature, 15 to 30 degrees Celsius or 59 to 86 degrees Fahrenheit, throughout the duration of transport. You must be careful not to let room temperature samples get too cold or too hot. You must keep insulated specimen transport container closed at all times when transporting specimen. This will preserve the temperature. Never let samples be exposed to direct sunlight. If there is a question as to the sample's transport requirements, contact the dispatcher and the dispatcher can look up the test's handling requirements. Samples found in the refrigerator or in a lockbox with ice packs should be kept cold throughout the duration of transportation. Refrigerated transport is recommended at 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit. Blood vials that have been separated by centrifugation are commonly kept cold to preserve specimen integrity for a longer period of time. Urine analysis tests will often be transported refrigerated. Always use a closed, insulated container with ice packs to preserve temperature. A barrier is necessary to be placed between ice packs and samples to prevent freezing. Never let samples be exposed to direct sunlight. If there is a question as to the sample's transportation requirements, contact the dispatcher and the dispatcher can look up the test's handling requirements. Samples that are to be sent frozen will be labeled frozen. Samples labeled as frozen must be transported on dry ice. You will use a dry ice container when picking up the frozen sample and will place directly on the dry ice. You must be careful not to freeze a sample that should not be frozen. Dry ice will destroy samples that are not prepared for freezing. Never use dry ice to refreeze ice packs. The ice packs will become too cold and damage the specimen, ruining the ability to perform testing. Never empty a dry ice container to use as a refrigerated container. The residue left from the dry ice will destroy a refrigerated or room temperature specimen. If there is a question as to the sample's transport requirements, contact the dispatcher and the dispatcher will look up the test's handling requirements. Freeze and thaw cycles will damage the specimen, so it is important that dry ice is used to keep a sample frozen. Dry ice can be purchased at many supermarkets or welding shops in an emergency. The distinction between on-ice versus frozen specimen is very important. On-ice specimen require transport with regular ice. On-ice samples need to stay cold but must not be frozen. These samples are usually packaged with ice against the specimen bag to preserve its temperature during transport. Frozen samples will always have the word frozen, either on the requisition, vial, or specimen bag. This will indicate to you that the sample must be transported on dry ice. On-ice samples must never be transported with dry ice. Contact the dispatcher if you are unsure of the storage requirements of the sample. Surgical pathology specimens are usually specimens sent in formalin fixative, which will preserve the sample for an extended period of time. Couriers will sometimes need to deliver specimen directly to the surgical pathology. Surgical pathology is located on the second floor of Stanford Hospital. Room H2130 is the receiving room for all surgical pathology samples. All surgical pathology specimens must be placed in the glass door refrigerator located near the door of room H2130. To get to room H2130, go to Stanford Hospital Emergency Department entrance. Locate the elevators near the emergency entrance and take the elevator to the second floor. Exit the elevator and take a left turn toward the hallway sloped downward. The hallway has black grip tape on the floor. Proceed down the hallway until a small white drinking fountain is visible on the right-hand side. The drinking fountain is located directly across from the restrooms. Room H2130 is located next to the drinking fountain. Once the door is opened, the surgical pathology glass door refrigerator will be visible. All stat samples need to be processed as soon as possible. Route drivers who are handling stat samples should notify dispatch immediately. All stat samples are electronically tracked by dispatch to ensure timely delivery. Stat samples must be delivered within an hour and 15 minutes. At the end of your shift, remove all containers from your vehicle and inspect each container to ensure that specimen samples are not inside. Log your mileage on the cover of the route sheet. Initial the route sheet cover page when completed. Wipe down coolers with paper towels and return to the vehicle, leaving the ice packs inside the regular freezer, not the dry ice freezer. Thoroughly inspect the vehicle floor, between seats, and the cargo area. Dispose of all trash in the appropriate trash bin. Never place any waste marked as biohazard in the regular trash. There is a biohazard waste container at the Hillview office. Before you complete your shift, you must have a coworker inspect your vehicle and all transport containers to ensure that there are no samples inside. After close inspection, your coworker will then initial the route log sheet cover page to acknowledge a cross-check was completed. Close all windows and lock your vehicle. Stamp the front page of your route sheet to establish completion. Place your route sheet in the appropriate drawer.